Epic charting in the Harborview Burn Clinic. We will cover the data elements to input and review, orders and smart sets, note templates, and closing and forwarding your note. As a courtesy, order medications and referrals prior to completing your note to facilitate patient discharge from clinic. After you log on to Epic, be sure to select HMC Burn Clinic. On the schedule, there are colored dots that indicate the status of the clinic visit. Green indicates the patient is ready for resident evaluation. Click on the green dot and change it to yellow. Enter new visit diagnoses or transfer them from the problem list by clicking on the paper icon with a blue arrow. It is important to include location, laterality, and degree of burn. Under encounter type, select initial or subsequent encounter as appropriate. Sequela is rarely relevant in the burn clinic. Visit diagnoses should be in the problem list, but not all items in the problem list will be included in the visit diagnoses. Add relevant comorbidities as a visit diagnosis, specifically those considered for operative risk. For example, diabetes contributes to the complexity of wound care due to the risk of infection. Other examples include chronic anticoagulation and smoking. Once you have added visit diagnoses, click Mark as Reviewed. Under the Orders tab, there is a smart set called Burn Wound Care. Right-click on it, add it as your favorite, and it will show up for every patient. You can order topical meds given to the patient in clinic and place referrals for rehab psychology and occupational therapy. For medications, verify the pharmacy and e-prescribe all medications except narcotics, which must be printed. For labor and industry patients, enter in medications and pen the orders for the attending to sign. Be sure to also mark as reviewed allergies and past medical history. Is this a new or established patient? To help you determine this, click on the tab Mindscape, then Transcripts to see if the patient has been seen before by a member of the team. Look for a discharge summary, clinic note, or a consult note if the patient was fast-tracked. Burn falls under the general surgery group, and billing providers are attendings in ARNP or PAs. If there is a note or billing provider's attestation in the last 3 years, the patient is established. Otherwise, it is a new patient. After the burn heals, some patients develop a scar which can be graded for future comparison. Go to More Activities, Flow Sheets, then click on the tab Vancouver Scar Scale. Enter the numbers to grade the scar. The worst site is usually graded. To grade more than one scar, click File to save the column, then Insert Column. Press OK when the date and time box pops up and a new column will appear. This is automatically imported into the note if it is completed before starting the note. For progress notes, there are 3 templates: acute burn, healed burn, and late effects burn. Select the appropriate note template. Here's a sample template. Press F2 to fill in the fields. The template is a skeleton to assure that burn-related items are included in the note. Additional elements can be entered with NoteWriter or free text. To add history from the chart, which is necessary for all preoperative history and physicals, use dot phrases. .pmh for past medical history, .soc for social history, .famhx for family history. Select ROS or physical exam at the top of the note. Here you can select symptoms within the review of systems or physical exam findings within each system. Include relevant systems that you observe and examine when interacting with the patient, such as those marked here. Your selections will then show in the note. To graphically describe physical exam findings, click on one of the other systems, such as skin or musculoskeletal. Select the specific area that is injured. Use the pencil to draw the area of burn, healed, not yet healed, or donor site. Select the hashtag and click on the location to add a description. The image and description will show in the note. Continue to use F2 to complete your note. Under Assessment and Plan, choose the first option, and the visit diagnoses you previously entered will be imported. Type additional free text to reflect your full assessment and plan. To forward your note, select New Communication under the Communications tab. Select Primary Care Provider and any other providers as the recipient and route the draft to PUHIM letter pool. Complete the letter as needed before routing upon closing encounter. To code the visit, under the Discharge tab, select Level of Service. Click Level of Service and a box will pop up to help you determine the level based on complexity of history, exam, and management. The components that define the level of complexity are summarized in this chart. Be sure to add GC to indicate you are a resident seeing the patient. If you see a telemedicine patient, add GT. And now you are ready to close your note and forward to your attendant.